I'm Dr. Jeff Lewis, a former Major League Baseball physical therapist that helps injured pitchers get back on the mound. And I want to talk about today a bit of a concerning trend that I see in the PT industry, and that is those that take a stance against manual therapy and those that take a stance against exercise. So, why do I think this is important? Unfortunately, there's a lot of times where I have patients come to me after going to other, providers, clinicians, locations, whatever you want to call it, and it's sometimes either one or two things. They're either skipping any of the basics and going right to some higher level loading strength work that they're not necessarily prepared for. And then the other side of that is they're only doing manual therapy and not loading tissue appropriately. So when we kind of look at both sides of the spectrum here more than anything, you have the one camp that just says, you just need to do manual therapy, just get them out of pain and the rest gets taken care of. And then you have the other side that says exercise and loading is king. Don't waste your time on manual therapy or doing any of that. It's a waste of time and it's not really doing anything to change the actual condition. Now, my philosophy more than anything is if you live on both sides of those, on either sides of those spectrum, you truly don't have a good grasp or understanding of what really needs to be done. A lot of times where good clinicians operate is right in the middle, where there's a time and place for this, there's a time and place for that. I am a very exercise-based, I take a very strength and conditioning approach to rehab because I truly believe that is what you need, or especially for the athletic population, what athletes need to truly push the envelope and get back to what they're doing. However, there's very much a time and place for manual therapy, not only from a standpoint and a post-op standpoint where we are getting range of motion back, but there's plenty of times when I was working in the professional setting where some guys come in and they're just absolutely hanging. They just really can't tolerate a lot of exercise there because they're pitching every day or whatever that looks like. Their workload's super high. So manual therapy is a great way to get the tissue in the nerve system to wind down a little bit and really just to get them in a little bit more comfortable environment. And when you get them in that more comfortable environment, then it opens this window of, okay, now we can go ahead and load in an appropriate manner. So that's why there's really has to be an approach to both of them. In general, when I'm early on in a rehab with an individual, especially if they're in a very flared up or acute state, there's going to be a very manual therapy based approach. There's going to be a lot of some type of maybe joint mobilization, soft tissue work, some type of fascial manipulation, dry needling. So all different types of techniques like that. Not necessarily using all of those. We might be using either one or a combination of the two of them. And I honestly will do those right at the beginning of the session. In some cases, I needle individuals at the beginning of their session and then I load them after, especially for very flared up tendinopathies. I'll needle them initially because there is going to be an analgesic effect and just a good inflammatory response that we can then follow up with from a loading standpoint. Generally, a lot of people feel pretty good about 45 minutes to an hour after needling. So it gives us a window of opportunity of, okay, let's start to load this tissue. So I really think that, let's take it from the kind of athlete standpoint. If you're going somewhere and you're already a couple months out for rehab and a lot of your work or a lot of what you're doing, you go to therapy, is a lot of soft tissue and manual work. You're not really doing a lot of loading, whether it's from a gym standpoint, there's probably some times to rethink some things. I certainly do that stuff with guys. If a guy's building up in the throwing program, they come in, they're a little bit sore, we'll start off with some manual work, some fascial work to get them feeling good, and then we go right into loading. That takes maybe 10, 15 minutes at most of the beginning of their session. Now, the other side of that is if you're fresh out of surgery, let's just say you're 3 weeks after elbow surgery and they're already saying, hey, go in the gym, start doing floor press, stuff like that, which, as crazy as that sounds, that has happened. I've had guys come to me after going to places where they've been like that. And then it's a matter of, okay, listen, I'm still got a little bit of swelling in my elbow. My range of motion is not as comfortable as I want it to be. That's where you're going to need a little bit more of an emphasis on that manual therapy. It's all a sliding scale more than anything. So again, it's just really important that as a profession, we move away from these dichotomies of we are either all manual therapy or we are all exercise, lifting, and not one or the other. It needs to be an appropriate balance of right in the middle. You might shift one way more than the other. You should, as you're either at the beginning or the end of the rehab, but you should never be all the way towards one way and not all the way towards the other. So again, if you have questions about how this should look in your rehab process, drop them below in the comment section or subscribe to our channel for content.